So welcome to another edition. Tonight's topic is allergy type of things again, atopic dermatitis. So the other way that atopic dermatitis is known as is eczema. So why did I start by saying allergy type of thing? Well, it turns out that allergies, eczema, and asthma, some of the topics that I've done recently, they're kind of like three strands of a rope. If you have one, it's very much more likely that you're going to have the other two going along at the same time. And so it's no surprise that when people have a family history of one of these things, hello everybody, when you have a family history of food allergies, hay fever, or allergic to pollens that are in the air, or asthma, that it's much more likely that someone's going to have a outbreak of eczema or atopic dermatitis. So I was a little bit surprised to find out just how common is eczema. I mean, I see it all the time in clinic, but it really shocked me to find out that about 20% of people around the world, 20% of folks around the world approximately suffer from some version of eczema or dry skin. And so in the early stages, it tends to be a patch of skin that's a little bit itchy, a little bit red, oftentimes a little bit scaling. And sometimes when the immune system is reacting to something, it makes it a little bit bumpy as well. And that in children is usually on the upper body at some location. And then when it progresses, it gets to be thicker, scalier, leatherier lesions as well, and so forth. Yes, and that's one of those things that in the beginning you sometimes find that some rashes look very much like other rashes, and so my rule of thumb is that when I see a red itchy rash, usually I'll go with a antifungal cream first, because in this location in Florida, it's very, very common that people have some sort of fungus or another. And so in that case, if you treat a red itchy rash with a fungal cream and nothing happens, and then you go to a steroid cream and it gets fixed, then sometimes that goes along with the diagnosis of eczema. So, other risk factors for eczema. So I mentioned family history. So believe it or not, it's very, very common that if one family member has it, others in the family will have it as well. And as a matter of fact, half of people that have eczema have a relative with asthma as well. And again, it's something along that. Farhan, when you're writing, if you wouldn't mind to put a whole question in there, it's kind of hard to see if you just put antifungal cream. Like, is that a question or what? Anyway, but to keep going with it. So there's a few things you can do that will reduce your risk. Obviously, we can't choose our parents once we're out here in the world. And so as parents, to reduce the risk in our children, especially if we have eczema as well, it's so that we, when possible, breastfeeding can be very helpful for reducing the lifetime risk of the children developing eczema. And so one of the recommendations that's out there is to breastfeed for the first 3 months of life. And that is useful for a lot of people. However, occasionally people have a medical condition where they can't produce very much breast milk. Maybe their thyroid's out of whack, maybe they've got a disease, such as HIV, or many, many other circumstances make it difficult for mothers to be able to provide that breast milk in the beginning. And as I saw it recently said, a fed baby is better than a not fed baby. So in other words, sometimes people are trying so hard to breastfeed that they don't notice that the baby's not really thriving. And so again, this is another one of those reasons why you take the information and use this in conjunction with your own personal physician and your pediatrician and so forth. So use this as things to enhance discussion. But anywho, so there's a few things that can also be helpful for preventing eczema in the children. And one of the studies that I came across on Nutrition MD was one that talked about avoiding alcohol during pregnancy. And so basically it was showing that when women were having fewer than 4 drinks per week during the pregnancy, that the children were much less likely to get eczema. Now, I would caveat on that the current recommendations in general are to have no alcohol at all during pregnancy because of the risk of fetal alcohol syndrome. So that's kind of an relatively easy one to get. The trouble comes sometimes when people don't realize that they are pregnant the first few weeks. And then another one was done over in Japan, and they were noticing that as the Japanese became more westernized, in other words, they were changing their diet and getting much more things like fried foods and heavier in meats and dairy and all sorts of things we associate with the Western diet. And they were finding that the women that ate more meat during the pregnancy, their children were also getting a higher risk of eczema as well. The study was not big enough or detailed enough to find out what exactly part of that was the problem. And if you watch some of the other presentations, or if you go to my other favorite reference, nutritionfacts.org, you'll find a lot of information about different ways in which meats tend to be contaminated with different things, or just of their own fact tend to be inflammation provoking as well. So more on that later if you'd like to look into it. But anyway, the study essentially showed an association between more meat in pregnancy and higher risk of disease in the infant. So again, breastfeeding minimizes the exposure to things like cow's milk proteins, because obviously if you're using human breast milk, then you're not going to be giving the baby as much cow milk. And so there was an interesting study or theory that also if the mother is drinking milk or eating dairy products like cheese or yogurt and things like that, that they're still getting an allergy causing proteins in their body, which then can be transferred via the breast milk in small amounts to the child as well. And so basically it was an interesting theory that potentially that the adults, the women who are breastfeeding, if they also reduce their amount of dairy that they're having, they're also potentially exposing the children as well. So you're suggesting, Farhan, so adults who have eczema haven't got history as opposed to children. I don't think that's true necessarily to draw that conclusion because, again, it is very, very common. But it is indeed that when children are born, it's very common that asthma, eczema, and allergies start within the first few years of life. And so that's when you often run into it as a physician, is because the children are getting these dry, scaly patches of skin as well. So a few other things. So if you are having a newborn and you're unable to breastfeed exclusively for the first few months of life, as sometimes is the case, one of the good alternatives to that is a whey protein formula that's been extensively hydrolyzed. So they make these formulas to be low allergenic. So in other words, the whey protein is in there, it's a cow's milk kind of protein, but it's been blasted to pieces, so there's not as much chance that that protein will cause any type of reactions in the infant. And apparently for the children, the babies that are allergic to cow's milk protein or have a reaction to it, about 90% of the time or so, it is a good type of formula to use. If you want to go really crazy with it, there is actually some amino acid based formulas where things are really, really broken down to the amino acids, and there's very, very little chance of a full formed protein being able to be recognized by the immune system. And those are completely non-allergenic formulas is one of the ways in which they're called. So there's different ways in which women or families, of course, want to involve the fathers in the care of the children, of course, different ways in which adults can feed their children. And so if you're able to do breast milk, that seems to be the best for preventing this, followed by the extensively hydrolyzed whey protein or the amino acid-based non-allergenic formulas. Another strategy that's been studied recently is delaying solid foods until about 4 to 6 months of age. And so again, this is why it's nice to talk with your personal pediatrician and just find out what is the latest recommendations for the care and feeding of your child and your own personal circumstances. So if you delay the introduction of solid foods until 4 to 6 months, well, that's also reducing the exposure of the child's immune system to these different proteins that are found in the food. So there's some interesting research I came across where basically they're looking at how is it that our bodies decide what is us and what is foreign or what needs to be attacked. And in the early, months, the baby's intestine wall is not quite as tight. It's a little bit looser and more permeable, and so maybe more of these proteins are getting through to the immune system where they're getting more exposed. For whatever reason, there seems to be some associations between some of these early exposures and development of asthma, eczema, and childhood allergies as well. And there was another recent one too that was talking about reducing exposure to dust mites. And they were suggesting that using different kind of mattress covers and other things really reduced the exposure to dust mites, and they had about 67% was what was found in their reduced dermatitis. And this is where sometimes interpreting some of the research from these different resources can get a little bit tricky, because on one hand, Dr. Barnard has that presentation, and then when I was looking through Dr. Greger's resource, nutritionfacts.org, there was another thing that talked about how they studied the air in the children's rooms, and that they found the more chemicals, in this case they studied propylene glycol and glycol esters. Those are long-named things that are common in things like cleaning fluids and paint and pesticides and PVC pipes and other kinds of things. And basically those kinds of what we call volatile organics, sometimes there's things that can be off-gassed from plastics and such, and in certain people it also can trigger the immune response as well. I know with my own lupus that if you had a chance to watch my lupus video at one point, I found that sometimes the immune system can be very much stimulated by cleaning chemicals. There was a day before an inspection when they had all of us in on the weekends. We were in there and everybody brought their own personal favorite cleaning products. And so walking into a small clinic with all of these various fumes, I felt in about a few minutes actually that walking through this chemical sea was not good for my immune system. I could actually feel the flare coming on, and so I kind of sequestered myself to an area that was better ventilated, and I had my my vinegar and dish soap and other things to wipe down surfaces with that was not quite as volatile or organic as it were. And so that's just one small example as well. So there seems to be something to the fact that increasingly we're just kind of surrounded by a chemical stew, and some of these chemicals can be stimulating to the immune system as well. And that's some researchers are suggesting that might also be a theory as to why across the world we're seeing just a gradual increase in the amounts of these diseases of eczema, asthma, and allergies as well. Alrighty, so another thing that can be done is when somebody has eczema and that's been diagnosed and you've gotten your rash and you've taken it to your physician or your primary care doctor or manager, as they call it these days, and they confirmed, yep, that looks like eczema. What kinds of things can you do to treat it? Well, the first thing is to avoid things that worsen it. And there are certain soaps and detergents, again, very common that they would have some of these additives and such with it that might trigger it. Food allergens, in just a moment I'll go through some list of foods that are very common triggers for eczema. And then certain cosmetics, again, because when cosmetics are used, there's various pigments that sometimes can trigger the immune system or that can trigger local reaction as well. Another thing that's key for eczema is not overwashing. Now, one of the unfortunate things is that when you have a dry, itchy skin, hot water feels amazing. And unfortunately, that very same hot water that feels so nice on that dry skin, what it's actually doing is it's taking away your skin's natural oils, and it basically ends up drying the skin out even more than when you started that lovely shower. And so one of the things I recommend for folks with either the common winter itch or that are having eczema flares is to reduce the temperature of the water. It does not have to be room temperature cold water by any means, but it really ought not to be on the really hot side. So sometimes just simply reducing the temperature of the water by a few degrees can have a big impact on the level of dryness of the skin. Next, when you get out of the shower or bath or whatever method of bathing you're using, patting dry the skin is a very good thing to do rather than rubbing the skin. So when you pat dry the skin with the towel, then you're not irritating the skin and you're soaking up that extra water. And basically it is making it so that the skin gets dried but not irritated and annoyed, so to say. And so, yes, Farhan, warm water is fine for dry skin. Just everybody's perception of what warm is a little bit different, so use your judgment on that. If you use cooler water and it works better, then, well, that might be your answer as well. So, next, once you get out of the shower and all dried off and all patted down and all toweled off, what should you reach for? Well, reach for some sort of a moisturizing lotion. And again, this is another spot where having some knowledge about what is that lotion based on can make a big difference. Lotions that have a little bit of oatmeal in them tend to be very nice because the oatmeal itself has some very good anti-itching properties to it and so forth. So there's a few of those available commercially. And also using a emollient base. Now that essentially means an oil-based kind of lotion. So there are lotions that are water-based, and then there are lotions that are a little more thicker emollients, as I mentioned, that oil-based kind of thing. And so when you're using a water-based lotion, it actually, ironically, sometimes will dry out dry skin even more, because as that water evaporates, it pulls out your natural water that you should be having along with it. And it ends up, although it might rub in nicely in the beginning, eventually the skin gets drier, and so you're reaching for more lotion, and it sets up a little cycle there. And also, sometimes the chemicals that are used in the lotions, such as the fragrances, are very common. Sometimes that can irritate the skin as well. And so a lot of the hypoallergenic, maybe oatmeal-based, thicker emollient kind of lotions, again, depending on how severe the dry skin is, those tend to be a little bit nicer. If you really want to intensify that lotion or intensify anything, you can take that, like let's say there's a little tiny patch that you're really trying to heal up with some thick lotion. You can actually cover that area, and sometimes covering an area will intensify it. So occasionally if people have dry skin on their hands or dry skin on their feet, have them do one of those thick lotions and put on a dedicated pair of socks or cotton gloves, and then they kind of let that soak in overnight. And basically when those things are applied in that way, then the moisturizing effect is intensified. Again, that's some of the reason why it's important to have a good diagnosis prior to applying some of these methods, because let's say that you've got a fungus on your skin and now you've lotioned it up and put a barrier like a cotton glove or something over it, and you forgot to try your antifungal cream on it first. Well, now you've got a perfect environment for that fungus to spread, and so you'd be like, oh my gosh, why is this, why is this worsening? And it was because that's why it's important to have the right diagnosis in the first place. So sometimes a diagnosis of exclusion can be helpful, or just common things, or if you had something for forever, you kind of get a sense for how your own body reacts to different things. And so those are a few ideas to get you started, and how to intensify the moisturizing treatment. Some people will also use a humidifier if they're in a dry climate in particular. I used to find when I was living in Massachusetts a long time ago that the hands would get really super dry and cracked and all that. But since coming down to moist, humid Florida, then the moist air is wonderful for the skin as far as not getting dry skin most of the year. It tends to be a little bit drier around here in the winter time, and that's pretty common across the entire country, partly because the colder air just doesn't seem to hold as much moisture, but also the heating and air conditioning systems, they have a tendency to pull the moisture out of the air. And so if the air is getting to be dry, and then sometimes a humidifier, of course, keeping it clean so you're not like growing mold or whatever in those things, can be very helpful as well. So other things you can do for itching. So we talked about different things to do with the bathing and such in order to make it better, but also you can use certain medicines. So antihistamines, those would be the class of things like Benadryl or Claritin to get some relief without being quite as knocked out as with the Benadryl. And then sometimes topical steroids, that's like your hydrocortisone creams, and some thicker, stronger creams like triamcinolone creams and so forth. There's a whole spectrum from over-the-counter to much more intense prescription grade medications that you can discuss with your personal physician as well. And sometimes when things get really severe, and then you can also use oral steroids, so prednisone tablets, steroid burst, and Solu-Medrol dose packs, and those kinds of things. Sometimes can be used for short term for severe cases. Occasionally a couple other creams like tacrolimus, cyclosporine, and for really severe cases, sometimes UV light exposure that's done in a dermatologist's office can be helpful. And so that gets a little bit to Farhan's most recent question about children playing in the sand can increase eczema. Really, I don't think so. In fact, sometimes a little bit of UV light exposure can decrease the eczema as well. Obviously, weigh these all things. You don't want to be sitting out there baking in the sun either, because more UV light increases the risk for certain kinds of skin cancers as well. So again, not too far extremes in any direction, please. Alrighty, so, and then this gets to my favorite part of the talk, where I want to talk a little bit about the foods that can influence eczema as well. So there are certain foods that tend to be a little bit more stimulating to the immune system, or that are more commonly stimulating to the immune system. It might be a better way of saying it. And for children that are diagnosed with eczema or atopic dermatitis, if you want the fancier word for it, the 4 most common foods that can trigger it are eggs, cow's milk or dairy products in general, soy, and wheat. So those 4 foods in about 90% of the allergenic foods that kids are commonly exposed to. Obviously, there are a lot more allergenic foods that are out there, but if you avoid in a child, the idea would be if the child has eczema and they avoid those 4 foods. And again, just to list them out, eggs, dairy, soy, and wheat. About half of the children that have the eczema will experience some sort of improvement over a week or 2, potentially up to a few months of reducing the exposure to those foods. So if you're running the experiment with a child's diet and you are very mindful to eliminate those 4, just keep an eyeball on, and if the rash gets better in that time, sometimes people will do a re-experiment where they'll reintroduce things back in. Dr. Barnard on his nutritionmd.org website has some wonderful articles about how to do a allergen reducing, eliminating diet, and then how to add things back in if desired. Obviously, a lot of these things are not requirements for food. And then an interesting thing for adults. So there's this phenomenon called oral allergy syndrome, which basically when the immune system is sensitized against the most common one for terms of eczema is birch pollen, then there seems to be something about that birch pollen protein that seems to resemble something in the skin, or basically it can trigger the immune system. So it's not that these particular foods contain the birch pollen per se, but just the protein is similar enough to something in our bodies that our immune system decides to attack, that sometimes eating the foods that have that birch protein-like protein can basically cause a trigger of the eczema. And so I'm going to read off this list. This is coming from another reference called uptodate.com, if you get a chance to check that one out. It does have a lot of good patient information, although this particular list comes from the doctor version of it. And so, and this is kind of broken down by class of plant as well. So the first class of fruits that contains birch pollen-like protein that can trigger eczema are apples, plums, peaches, almonds, apricots, hazelnuts, cherries, and pears. And those are 2 different families of trees that have a protein that's similar to this. The next category that also can sometimes trigger it is carrots, celery, parsley, caraway seeds, fennel seeds, coriander, and aniseed. So that's the next category that can potentially trigger it. And the final category is includes the soybean and the peanut. And so occasionally when I see people and I show them this list of foods that sometimes can trigger eczema, they go, oh my gosh, that's a huge list. How could I ever, I love all these foods that are on there. It doesn't necessarily have to be a complete elimination, although if you do that, it might get you the best results. But the idea would be to maybe for 1 or 2 weeks, maybe 3 weeks or something, be very mindful to eliminate those particular foods, and then again add them back, maybe 1 category or so at a time, and then see what happens. So one patient story is I had somebody, I guess maybe 2 years ago, sometime in the past, and she was having these rashes and she could not figure out how to get them to go away. And of course, I don't think any of the physicians or providers that she'd seen to date knew kind of this link between the certain foods and the eczema. And so I showed her the list from Dr. Barnard's NutritionMD website, and I showed her the list from the UpToDate website on the foods that match the birch tree pollen triggers. And she looked at that list and realized that right before her rash had gotten much worse, she had really started to go healthy, and she had got a juicer, and by golly, she was making a ton of carrot juice with celery. And it turned out that when she reduced the juices, she stopped it for a little bit and then found out that as she was able to add a little bit back in, she was able to have a little bit of carrot or a little bit of celery, and it did not trigger the rashes at all. Whereas when she had a lot of carrot and celery for her, and that was triggering to the immune system. And so again, when it comes to these lists of foods, it does not mean complete abstinence of these foods in most cases, but it's just that if you have an awareness of it, then you have a chance at steering around it. And if you don't have an awareness of it, then you go and go through life and just wonder what the heck happened. Why is it that you're trying to do something awesome and healthy, and yet it's triggering this particular problem? So, and I find that a lot with the allergy foods for the lupus. So this is one of my favorite topics, because a lot of personal experience with using food to trigger or avoiding certain triggers to help control the disease as well. Alrighty, so I think that I've covered almost everything that was on my list. I guess the only one that I haven't really covered yet is another thing, food additives. Just as in the same way that a lot of these household products and fragrances and so forth can be potentially triggering to the immune system globally, certain food additives tend to be triggering. So nitrites, benzonates, tartrazines, balsam of Peru, and natural and artificial vanilla for some people can be triggering for their immune system. And this is another interesting one too. So there's a lot of studies on women who are pregnant and the effect of what they're doing with their bodies and what happens to the children later on. And so one of the things they studied was giving the mothers a probiotic supplement, and this was a lactobacillus thing. And by the way, I don't necessarily recommend supplements in general, partly because lactobacillus is so darn easy to get in food form. So for example, soy yogurt or coconut yogurt or things along those lines. There's a lot of different ways in which you can get lactobacillus. Even if you go out to your garden, provided you have a garden, and pick yourself a bunch of cabbage leaves, those cabbage leaves would naturally have lactobacillus on them, which is possibly one of the reasons why when people have a diet that's really rich in fruits and vegetables and whole grains and all that jazz, lots of plants, they very naturally have a lot of these bacteria going into their system that tend to be very calming for the immune system. Anyway, what they did was they gave the mothers this lactobacillus, and then after the baby was born, they had some sort of formula or something that they were giving the baby that also had some lactobacillus in it. And they found over time that the children who had gone through this stage, their risk for having the eczema was reduced by about 50%. So again, interesting kind of thing. So more studies are needed in this area, but it's just kind of fascinating to watch, where are they going with these research studies. And then another one is basically a vegetarian or vegan plant-based diet for about 2 months, and another batch of folks who are suffering from eczema. They found that their symptoms were reduced by about half as well. And so again, once you learn a little bit more about the anti-inflammatory benefits of a plant-based lifestyle, it becomes kind of a no-brainer, because you're like, well, duh, things like turmeric and berries and cherries and so forth are very, very anti-inflammatory. Now, I mentioned cherries, of course, except if you happen to be one of those very few people that gets triggered by cherries for your eczema. So again, it's all these things. It's just information to use to kind of look into the ideas, play with it yourself, find out if it's something that seems to be triggering for your own body. And as they say, take it with a little bit of the grain of salt, because sometimes other circumstances can influence the immune system too. So let's say you're eliminating carrots and celery, for example, because you have a suspicion, ooh, I think when I had a bunch of carrot juice, it caused my rash to get worse. Maybe I'll just stay away from it for a little while. Well, maybe you were also using one of those fancy new perfumes or something that had a whole bunch of propylene glycol in it at the same time. And so maybe at some point later, after you switched over to a gentler soap that didn't have quite so much perfume and so forth, maybe reintroduce the carrot and find out, hey, did it really, was it a real association, or was it just like a little fluke that happened because, lack of sleep or stressed out or something like that as well. So how to treat dry skin to avoid it becoming eczema? Well, again, there's a difference in degrees. So if someone just has a little bit of dry skin, again, as I mentioned earlier, you might want to go back and watch the video again. You can use some of those lotions, especially the lotions that contain oatmeal and that have a little bit of a thicker base to it, depending on how severe the dry skin is, and so forth. And of course, always talk with your personal physician as well, because the thing with skin conditions is they have a tendency to mimic one another. So sometimes the early stages of a fungus can kind of sort of look like eczema, and some other things can cause little dry scaly patches, like actinic keratosis, for example, usually found around the ears or on the nose or on really sun-exposed areas. So sometimes people will have these little tiny dots of dry skin that are kind of flaky and feel kind of rough. And those especially can be precancerous. And so again, that is why, as always, use this resource for educational purposes, and talk to somebody who's kind of experienced in looking at these things, and then you get a little bit more information, a few more resources with which to be able to engage with them to have a discussion. All right, well, thank you all. Love the little like buttons. Thumbs up to you guys as well. I wonder if that'll show up when I turn this into a YouTube video. Anyway, so it's been a joy. Have a great night, and we'll see you next week. Thank you very much. Good night.